Mental health and substance use-related structural stigma creates barriers to accessing health services. We asked people to share their experiences on how structural stigma impacts access to health services. These are their stories. Denial of care. Manon Charbonneau.
Une de mes patientes qui me demande, quand j'ai la chance de le faire, de témoigner de son expérience. Alors, il s'agit d'une jeune femme maintenant qui souffre de schizophrénie et qui est tombée et qui s'est présentée à l'urgence. Elle a dû se présenter à 3 reprises. Donc, les 2 premières fois, on lui disait que, ben non, il n'y avait aucun problème, puis qu'elle n'avait rien, puis qu'elle se plaignait pour rien. Donc, elle n'était pas bien accueillie, n'a pas eu les examens nécessaires, ni les investigations radiologiques nécessaires. Et ce n'est qu'au troisième consultation à l'urgence où finalement un médecin a enfin décidé de lui faire passer des radiographies. Et elle avait une fracture de hanche. Et malheureusement, aujourd'hui, elle a des séquelles au niveau de sa démarche parce que ça a pris beaucoup trop de temps. Je crois qu'elle a été 3 semaines avant que ça soit diagnostiqué. Si elle n'avait pas eu un trouble de schizophrénie, si ça n'avait pas été écrit dans son dossier qu'elle souffrait de schizophrénie et que c'était cette même jeune fille-là qui se présentait avec une douleur à la hanche ou à la jambe après une chute, je suis certaine qu'elle aurait eu des radiographies immédiatement.
Inequitable resource distribution. Rachel Grimmick.
There's just a huge gap between the needs of the population and the available resources, both physical and human resources. And so that leads to prolonged wait times in the community for mental health care. It leads to prolonged waiting times for psychiatric beds once a person is admitted to hospital. Just like there's ICU patients, when people are experiencing behavioral emergencies, they can also need a psychiatric ICU bed. And so in general, there are not enough beds of that kind across Canada, and that means that patients wind up waiting for prolonged periods of time in the emergency department, and where they're often not getting ideal care, and that's highly traumatic. And that experience can be so negative that people don't want to seek care in the future.
Trauma-informed care. Jess Bashara.
So I was experiencing homelessness at the time and was using opiates every day and really had no support or anything. We did have a methadone clinic open up in Brockville. So I did the intake, and it's really an intrusive, like you have to tell them everything about yourself. So it's almost like traumatic in itself, going through the paperwork and answering all the questions that they were answering. To go through it and then to leave there without any support or anything was really, it was a hard situation to go through. I didn't do well after that initial day. It was a pretty rough night, actually. I think we should be teaching all of our healthcare workers about trauma-informed care. I think it needs to be ingrained within our whole healthcare system.
Wait times. Jess Bashara.
By the time I got down there, it was a 3-month wait. You just leave a message on the machine, so there's no point to it except that if you missed it, then you're off the waiting list and you're back waiting 6 months or a year if you're lucky to get accepted anywhere else again. And I ended up missing a week and was kicked off the waiting list, which was very frustrating because I had worked hard. You know, I did the best that I could do to get as far as I had gotten, and I wasn't good enough. So it really was discouraging. It was really discouraging.
Changing cultural and policy structures. Manon Charbonneau.
We need to see, the mindset, cultural ideas changing slowly. And we've been seeing that, in the late, maybe 10 years. There's a difference. But it has to be in parallel with the change in structures or policies at different level. That's for sure.
The system needs to change. Rachel Grimmick.
I think in order to achieve equity, it would require, like ideally, a national or provincially coordinated response that would look at all aspects of life, essentially, right? In every area of government, that would include, workplaces, the financial sector, and how we support people on income support, the timeliness of having income. It would look at housing, which is critical. It would look at our schools and how do we provide education and basic education around mental health literacy. It would obviously include the healthcare system, and making sure that we have, quality indicators within mental health, and that we prioritize this just like we would other areas of medicine like cancer, cardiology. But this would require like a really comprehensive, systematic approach with good leadership. And I think so far a lot of the responses I've seen from our leaders provincially and federally it sort of feels like a bit of lip service. There's sort of these one-off funding pockets. It's not part of a coordinated response that's really going to look at all aspects of how we address mental health.
mentalhealthcommission.ca